Now, the next thing we have I want to talk about is radiation. Well, you see it there. It's hard for me to see it at this angle. Radiation is very important. Before I went to medical school, I was a radiologic technologist. And I did this for about 5 years before I, eventually got my bachelor's in diagnostic ultrasound, and then I went to medical school. I took the long road because I came from a very poor family. There was nobody to make the phone call to that, institution and get me in, because I had nobody in my family that could make that call, so I had to do it on my own. So I took a long road, but it was all for a reason. And when I went to school to become an X-ray technologist, I learned a lot about X-rays and how dangerous they are. Ionizing radiation. This ionizing radiation is actually cumulative. It stays in your body for the rest of your life. And I'm not saying never to get X-rayed. Obviously, you have to get dental X-rays occasionally. You have to get X-rayed before you get a chiropractic manipulation. This is a safety measure because they have to know what's going on before they start to, manipulate you. You have to get X-rays if you get a broken bone. And luckily, there are homeopathic nosodes that can also detox radiation. As a matter of fact, when I was an X-ray technician, I got exposed to a lot of radiation because back in those days, we had to hold the babies when they got X-rayed because they didn't have all those fancy gizmos to strap them in. So I got really a lot of X-ray dosage to myself, not to mention I had a myelogram and a few other, procedures. Yes, I have been a patient myself a few times. That's one of the reasons that I can't help but put myself in a patient's position when I'm dealing with them, because I've been a patient myself. I know what it's like. Anyways, you just have to always consider what are the pros and cons of anything that you do. And there's so many doctors, first they do a wallet biopsy. That's their first technique, okay? They find out what kind of insurance do you have. Oh, you have a good insurance. Okay, then we're going to order every diagnostic test there is known to man. We're going to get a CAT scan and a PET scan and MRI. Are they going to spend time with you and ask you any questions? No. Because all they do now is they just order tests, and if they happen to hit on something that comes out of positive, then they, go down that road. That may have nothing to do with what your symptoms are that you came to them initially. That's what the practice of medicine has become, unfortunately. And along those lines, I just want to mention mammograms. This is very important for all the women. I got a mammogram once, and let me tell you what they do to you. And I also did these as an X-ray technician, but of course having it done is a little bit more impressive. They take the breast and they squeeze it between two lucite plates. It's extremely painful. And then they position you and they shoot an X-ray beam through the breast. Now, it may seem strange, but it is in fact true that it takes a much higher dose of X-rays to go through the breast than it does to go through your chest, because the chest is mostly air, filled with, the lungs are filled with air. So they have to use a really high dose of X-rays to go through the breast. The breast is also the most radiosensitive area in a woman's body. So what they're doing is actually giving you X-rays, which are ionizing radiation, which mutate the DNA, which are going to cause breast cancer. In fact, if you have a lump in your body, it's going to disrupt the capsule of the tumor and spread the tumor throughout your breast. And it's totally insane how they're actually recommending to women to get mammograms every year. If you get a mammogram every year, you will get breast cancer eventually.